Despite all the political rhetoric over Obamacare, it's still the law of the land, and that law is still helping thousands of Montanans buy health insurance. MTN's Mike Dennison brings us the latest on the internet marketplace policies in Montana.
Earlier this year, Republicans in Congress eliminated the Affordable Care Act's mandate that all citizens must have health insurance. But Congress has not repealed another key component of the law: federal subsidies to help those buying policies on the individual market. Sign up for these policies is underway. The deadline to sign on and get the subsidy is December 15th, a week from Saturday. Just like in years before, Montana consumers who want the subsidy must buy a policy through the federal website, healthcare.gov.
Not much has changed, and I think people are becoming more familiar with the process. It's an opportunity for folks to go online, shop the differences between health insurers, shop the differences between the cost and the benefit structure, and find the plan that works for them. 3
insurers offer the policies in Montana: Blue Cross, Pacific Source, and the Montana Health Co-op. Currently, about 50,000 people in Montana have these policies. But they aren't cheap. They range from a low of $324 a month for young adults up to $1,200 a month for those approaching 65. And deductibles are in the range of $5,000 to $7,000 a year. Yet, if you earn less than 400% of the federal poverty line, almost $66,000 a year for a couple, you could be eligible for a subsidy. Richard Miltenberger of the Health Co-op says with the subsidies, most Montanans pay a lot less, sometimes as little as $50 a month. 85% of Montanans who bought policies in the past have been eligible for the subsidy. Despite a lack of publicity about the marketplace policies this year, Montana insurers say they're hoping enrollment will be pretty much the same as last year.
I think enrollment is still steady. A lot of people understand the value of having a health insurance plan, whether that's the access that you get to primary care or whether it's that financial safety net that you have in times of crisis.
Reporting from Helena, Mike Dennison, MTN News.
Thanks, Mike. And Mike tells us some alternative policies are becoming available. They cover less and cost less, but they do not qualify for any subsidies.